My name is Francis Wells and I'm the Clinical Director of Lung Health UK. We get asked many questions about lung health and in particular lung cancer. We get asked about the types, the stages and symptoms of the disease and also what the risk factors are. So here are some of the common questions that we hear. Lung cancer occurs when cells in the lung start to multiply out of control. As the cells replicate themselves, they produce an ever-increasing mass, which eventually becomes a visible and palpable tumour within the lung. At a stage which cannot be predetermined, cells will escape from the lung and settle in other organs such as the bone, liver and brain. This is why the early detection of lung cancer really can save lives. No, there are several types of lung cancer, but they are divided into two principal types based on behaviour and possible treatments. They are referred to as small cell and non-small cell lung cancer. The single most important factor between these two groups is that the small cell group begin to spread to other areas of the body very early in their development, which is why surgery is rarely an option for their treatment. However, all types of lung cancer unchecked will also spread, and again, this is why the early detection of lung cancer is so very important. The largest single cause of lung cancer is undoubtedly smoking, but it is true to say also that people who do not smoke can still be at risk. The passive inhalation of smoke from other smokers is a risk which cannot be ignored and has been much more appreciated in recent years. Other significant factors include forms of industrial exposure, such as chemicals and particularly asbestos. And indeed, if there is a family history of lung cancer, that also raises the risk of developing the disease. Most of lung cancers have no symptoms for a significant period of time during their development. Symptoms occur when the tumour encroaches on an airway or the chest wall. Hence, the most common symptoms include a persistent cough, coughing up phlegm, particularly if it has blood within it, or pain within the chest wall. More general symptoms such as loss of appetite, chest infections that don't respond to medication, and weight loss cannot be ignored and should be dealt with promptly. Therefore, symptoms do vary from patient to patient, and if you're concerned about any of these kind of symptoms we have described, you ought to consult your general practitioner. Lung cancer is the second commonest cause of cancer in the United Kingdom, and approximately 42,000 people receive this diagnosis each year. Smoking holds the greatest risk of developing lung cancer. For long-term smokers, there is a lifetime risk of 1 in 4 of developing this disease. 86% of lung cancers are caused by smoking. There is evidence that shows that there is an increased risk of smokers developing lung cancer if a close relative, a parent or brother or sister, has also had the disease. LungCheck is a unique early detection service for lung cancer. It is available to men and women over the age of 40 and available to both smokers and non-smokers. The service includes information about lung cancer, an online risk assessment based on symptoms, lifestyle and family history, and a unique blood test. Survivorship is entirely dependent upon the extent of the disease. Whatever the cell type, the earlier the diagnosis is possible, the greater the chance of effective treatment and cure.